Hey everybody, so I'm making this video for anybody like me who has had or is going to have a cervical disc replacement with the Mobi-C device. Today is Sunday, February 2nd, 2020. It's actually Super Bowl Sunday, and I had my surgery exactly 5 days ago on the 28th, which was Tuesday. So I'm 5 days post-op, and I wanted to go into a little bit, what got me to surgery, how I'm doing now 5 days later, what you can expect if you are in fact going to do the same surgery. As you can see here, that is my scar. I had the C5 and C6 herniation that just happened to be from wear and tear. Prior to this surgery, I do a lot of physical activities. For work, I'm a police officer, but I also enjoy playing baseball, doing jiu-jitsu, weightlifting a lot, running a lot, being a dad, being a baseball dad, helping my son train and whatnot. Excuse my voice, it's a little raspy, plus having Invisalign doesn't help. But so what symptoms I started with, just so we can get a little bit of a timeline of where this started. So in December of 2018, I started to get neck pain. At first felt like I slept wrong, but then it kept happening. And so telling myself I can't be sleeping wrong every single day. So then that pain started to go down my left arm, where I would get tingling and numbing. At the time, I went to go see an orthopedic. They sent me for an MRI. The insurance denied the MRI the first time. So I kind of just dealt with it. But I would notice, anybody who lifts weights knows, we usually have one side that's stronger than the other. I was always stronger with my left, and the opposite was true while I was going through this pain. So doing single arm dumbbell curls or something like that, I would notice that I was weaker on my left, where I had always been stronger. So insurance denies the MRI. I kind of just deal with it. Fast forward to maybe August of 2019. I go again to see the orthopedic. They send me for an MRI. This time the insurance approves it, and it showed the herniation in C5, C6. So at this point, they sent me to a surgeon. I went to see the spine surgeon, and thinking I was gonna be told, maybe injections or physical therapy would be a good resolution to the problem, but instead they said surgery was inevitable. I remember asking the surgeon, if I stopped all my activities, which I never would, and he kind of cut me off and tells me, you would still need the surgery at some point. So at that point, the decision was made, 38 years old, just turned 38 last month. So the decision was made to just go ahead and get it done now and move on. So planning and prepping and they told me up until the surgery, do whatever you want as long as you can take the pain. So I continued to lift weights. I continued to run a lot. I wanted to go in surgery as light as possible. I stopped playing baseball. I played in a Sunday adult baseball league. I stopped that a couple months before, only because the pain was affecting my performance. So I didn't want to, the ego was taking a bit of a hit. And so I didn't want to go there for 3 hours and not perform like I know I could with the pain. So I stopped that a little bit earlier, as well as jiu-jitsu. I think I went maybe twice in December, and then decided to give that a break until after surgery, where I would feel better. But lifting and running, I literally lifted and ran the day before surgery. I wanted to go in as best shape as possible, as light as possible. And so surgery was on Tuesday. I had the second surgery of the day And so I had to be there at 9 a.m. for surgery at noon. I can tell you immediately, if you've seen a lot of these videos talking about this procedure, a lot of people complain about throat pain, sore throat, hard to swallow from the beginning. Thank God Almighty, I didn't deal with any of that at all. At all. I actually brought my lozenges with me to the hospital because I knew I was going to stay a night, and I didn't have to use not one of them. I didn't have no issues with my throat, no issues with eating. My wife and I had planned for me to be, with a lot of protein shakes and smoothies and kind of soft stuff at first, and I was able to eat just fine from the beginning. But the throat thing was huge for me because that's kind of what I was dreading the most, and I didn't go through that at all. I can tell you when I first woke up, I couldn't talk. That was a little bit scary at first because you want to have words come out, and I just couldn't talk. I don't know how to describe it, but I remember going like that, to the nurse, like, give me something to write with. But eventually, sometime later, I was able to talk without a problem. They didn't want me walking the day of, so I stayed overnight. I had dinner that night without a problem. I forgot what they gave me, but I know I had soup and I had turkey, mashed potato. I ate just fine. The next day, which was Wednesday, they kept me for up until probably midday. Obviously they're giving you antibiotics, they're giving you different kinds of meds. I didn't want any morphine, I didn't take any of that. I didn't take any Percocet, and what I've been taking is Tylenol with codeine to kind of help you rest, because you can expect some discomfort. I wouldn't even say bad pain, just discomfort. They kind of mess with you in there. So you're gonna deal with some tightness, a little bit of soreness. Even now, 5 days later, I'm walking a lot. I've been out of the house. My son had a baseball practice this morning. I went and I watched him. I've been walking, even when I didn't want to go outside, I've been walking around the house. I walked around a lot in the hospital. I walked right out of the hospital. Protocol says you have to come out in the wheelchair. I refused that. I wanted to walk out on my own. And so the walking has been good. But you are going to have some tightness. You are going to have some just uncomfortableness, in the area. So like right now, 5 days later, I'm dealing with that a little bit, where it's just restlessness and just tight because of where they were doing, where they messed around. But that's it. I've every night still, so today would be the fifth night, I'm taking Tylenol with codeine, kind of help me sleep. I've been taking ibuprofen 800, kind of help with the inflammation. But overall, been feeling fantastic, all things considered. If you're very active like I am, the hard part is sitting still, and so that's been a challenge. I've got 37 days until I can work out again, but who's counting? And but I can tell you, it's day 5 and I've sat and watched one movie since I've been home. It's tough for me to kind of, I'm very busy usually, so that's the tough part. But overall, fantastic. I know some people in other videos I've seen, they woke up and they didn't feel the numbness anymore in the arm. Some people felt it for a little bit and then it kind of went away. I didn't feel it at all. As soon as I woke up, that tingling, sensation I had going down my left arm has been gone. Obviously, once I'm able to go back and work out, I've got to baby step it to get my strength back there. Because like I said, even leading to the surgery, where I was working out, I had to make certain adjustments to what I can do because of the weakness in my left arm. So I can do most things, I just had to go lighter. But one thing I couldn't do is I couldn't do like you know, for sure, you know, shoulder presses with dumbbells. You made me do that a few weeks ago or even last week, and I would, even with like a 20 pounder, I would kind of go up, and this arm would kind of like, I'd get like a dead arm thing going on. So I'm looking forward to being able to do that again. I don't do anything crazy. I don't lift very heavy anymore. But I am looking forward to going back to my activities without any pain or discomfort. So, and again, I did have it with the Mobi-C device. I had seen a lot of videos. I was very adamant about it, you know, wanting to have that device, the Mobi-C, because of the range of motion that I wanted to have. 5 days, you know, if you see, I'm turning my head just fine. I was a little hesitant at first because, you know, I didn't have a soft collar either. I wanted to mention that because I know some people, they do give you one. They wanted full range of motion from day one. You are going to be hesitant. They did kind of mess around in there, so I'm not going crazy. But that's another reason why I've been walking around a lot around the house, because outside you're going to deal with, you know, stray dogs or what have you, cars. I didn't want to make a quick movement to one way or the other. So looking up, you know, I'm not going crazy trying to do anything unnatural, but as far as looking to the side every day, it's a little bit better. At first you're gonna kind of want to turn your body and look that way. I did see the doctor before I left the hospital, and he assured me everything went in perfect. The actual surgery, I think they were in there about 45 minutes. Said it fit perfectly fine. So I was very relieved with that. They did mention, just in case you're gonna have this surgery, you know, they have to kind of mention some disclosures. So they did say, if by chance that the Mobi-C device didn't fit properly, they would have to do a fusion. So that was a bit, when they first told me that, was a bit kind of, really, you know? But then they followed it up by saying the doctors never had to do that. We just had to say that. So I said, okay. And thank God, you know, everything fit fine, and it's been great. I did leave with a bandage on the scar. Now I'll get close again so you can see it. The next day, they said go ahead and shower with the band-aid on, kind of soften up the adhesive, and then take the bandage off. And as far as showering now, I'm not scrubbing it like crazy. I'm not, you know, no hot tub, no bubble bath, letting it soak in water. I'm taking a regular shower. I'm kind of letting everything kind of fall down to it, and then I'm kind of pat drying it. But if you can see there, I mean, this is 5 days post-op. It's looking pretty good. I have my follow-up at the 2-week mark. I believe it's February 12th. So it would be in about 9 days or so. Hopefully by that point, I'll be driving. But overall, very happy with the procedure. Very thankful for everybody who put out videos about the procedure, because if you've put a video on the Mobi-C on having this procedure, I have looked at it, and it was very encouraging, because every video that I saw, everybody said if they can go back, they would have the surgery again. Not one person said they regretted it, and so that was very, very encouraging. I asked questions to some of those people, and they were great in responding. You know, so I wanted to kind of repay the favor for anybody who had any questions or concerns about my experiences, because again, almost everybody I saw mentioned having the sore throat, and I was very fortunate I didn't have that. So the experiences will kind of vary with everybody. And then one last thing I wanted to put in, if you have any questions, I mean, I'll put another video in about a week or so, or a couple of days, or whenever I get around to it. I'm home doing nothing, so I have plenty of time. But I did want to mention how I've been sleeping. So I got 2 wedge pillows. I should have brought it here and show you. I'm in my son's room. It's the only quiet area for the moment. But I got 2 wedge pillows. And so with the idea of one being at the head and one being from my legs. The first day I went that I slept that I try to sleep that way. My feet, you know, on an incline up, and my back on an incline up as well. That didn't feel well for the back. My personal experience. I felt a lot of pressure on my shoulders and on my neck, kind of like if someone was pulling down on the shoulders. So we kind of switched that up immediately, and I just went with my regular pillow. I do have a memory foam cervical kind of pillow that I had gotten a while back, hoping that it would alleviate the pain that I had. And I didn't want to be so flat with just the pillow, so we got like a thin kind of comforter, kind of rolled it up a little bit so that I'm not too, you know, up, but not too low, so it's a good medium, and I've been fine with that on my head. The legs have been propped up on that wedge pillow every day, so that's been a big help. And that's the way I've been sleeping, and that's the way I've been napping when I've been trying to get some rest. But yeah, so any questions or concerns, you know, by all means leave a comment below and I'll get back to you. And again, thank you to everybody else who put videos, because you did me a big favor and reassured me that this was the right move to make. All right, so God bless you guys, and see y'all soon.